turnout from the public. We had the very first, if you like, professionals meeting this morning, had a good turnout from that. This is a really important law to me. The law can potentially affect any of us. It's designed to safeguard the dignity, well-being of people who may not have capacity to make decisions for themselves, as well as enabling everyone to plan for a time when they may lose capacity for themselves. At present, Jersey does not have specific legislation to protect someone whose decision-making has become impaired. The new law has been developed with regard to both modern standards in clinical practice and with regard to legislation and case law in Jersey, England and Wales. In April last year, the team embarked on the task of delivering a new law by 2018, and I'm really pleased to know that they are on track to do so. More about that a little later. The importance of the legislation is that it provides clear principles in determining a person's capacity to make specific decisions for themselves, supports and protects those people who are charged with making best interest decisions for those who lack capacity, and how to protect the most vulnerable adults within our society, and that cannot be overstated. The Chief Minister and I have given our commitment to delivering a modern, evidence-based and usable law for the people of Jersey. So many jurisdictions have introduced capacity or mental capacity legislation, but Jersey is the first to emphasise the importance of self-determination. This law will support you, me, to plan for our health, welfare and financial futures in a way that ensures that our wishes, made at the time when we have capacity, are respected. We are also the first jurisdiction to embark on the challenge of introducing new legislation in parallel with the new mental health law. This allows these two pieces of legislation to dovetail well together. The work is being completed by my officers and the law officers, law draftsmen and Chief Minister's departments. Today you will receive presentations which will outline the rationale for how the draft has taken shape and identify some of the key themes within the law. You will have the opportunity to ask questions of the panel. However, it is really important that besides asking those questions, that we receive your comments via the States of Jersey consultation website, and this will help us shape a final draft law which will be launched with the States before the end of the year. The law has been developed in consultation with a range of stakeholders, including GPs, charities, the Law Society, the Viscount's Department, Judicial Grant, frontline health and social care staff. I hope you find the presentation informative and that it stimulates debate and discussion. So again, thank you for coming, but I'd also like to thank the officers who really have pulled out the stops to bring this law forward quicker than it might have been. That doesn't mean that it's been rushed, but it does mean that there's got some urgency behind getting this achieved for the people of Jersey. Thank you.
My name's Ian Dyer. I'm Service Director for Older People for Health and Social Services, and I'm the lead for the policy for this legislation and for the new mental health legislation. As the Minister says, the two pieces of legislation will be coming together and be lodged in the States before the end of the year. I want to take you through a quick overview of where we are, how we got to where we are and where we're going in relation to this piece of legislation. So we need to look at the reasons for change. Well, effectively, Jersey doesn't have, at this moment in time, any capacity legislation. We rely on customary law and other policy within departments. So we need to look at capacity and self-determination to safeguard dignity, well-being of people who may not have capacity to make decisions for themselves. We need to enable people to plan for a time in the future when they may lack capacity. And we also need to ensure that Jersey complies with the European Convention of Human Rights. The legislation process itself is we're looking at four phases. Phase 1 has been completed. That started, as the Minister said, April last year. And during phase one, we got a group of people together who we described as an expert dialogue panel. They included people from law firms, from magistrates, the judicial, Viscount's department, health and social services, including doctors, social workers, nurses. Looked at working with our colleagues in the voluntary and charitable sectors to come together to get an understanding of how we should develop the capacity law. During that process, we identified as well the requirement to work closely with mental health law, because there will be bits, as you'll find out this morning or this afternoon, that overlap where the two pieces of legislation. We then moved on to the drafting, so we took considerations of people into account, looked at the drafting process, and then submitted the instructions to the law drafting officer, who spent quite a bit of time looking at putting the actual draft law together, which is now what's out for consultation. So we also then prepared a feedback report, which was circulated to those who have been involved with the dialogue to make sure that we captured what they were asking us to do as we move forward. So that was phase one. We moved into phase two at the beginning of this year, and that was looking at the instructions. And we've now pulled together the instructions for mental health law, and that consultation took place up till the end of August, from June to the end of August, and the capacity and self-determination law consultation from 25th of September until the 13th of November. We are really keen to get people's views and opinions on the legislation, on the draft legislation, to make sure we're going in the right direction. We're in a lucky position because we can look at what's happening in England and Wales and through other jurisdictions and actually learn from it. And we know that, for example, deprivation of liberty safeguards within certain areas have been difficult to manage and difficult to actually implement. And there's been quite a bit of case or review of the legislation that has identified ways it could be done better. And so that's what we're hoping to learn from. The laws, as the Minister said, will be lodged before the end of this year. So that will then lead us on to the third phase. During the third